Today, we bring you a story from South Korea where the government has initiated an investigation into the unfortunate passing of an elderly woman in her 80s. Tragically, her ambulance was denied entry to several hospitals due to an ongoing doctor's strike. The patient, who suffered a cardiac arrest, passed away in the ambulance as paramedics faced challenges finding immediate medical assistance. Approximately 70% of junior doctors have been on strike for the past week, voicing their concerns about plans to increase the number of physicians. This strike has placed significant pressure on emergency rooms, with the government expressing concerns about the potential risks to public health. In the city of Daejeon, paramedics called around 7 hospitals seeking help for the woman, only to be turned away due to staffing and bed shortages. After a delay, she was eventually admitted to a public university hospital, but sadly, she was pronounced dead on arrival. The government has now pledged to investigate this case, which has garnered widespread attention in South Korean media. This incident is believed to be the first death linked to the ongoing doctor strikes, which stem from fears of increased competition due to government plans to add more doctors. The low staffing levels in emergency rooms have led to postponed surgeries and the transfer of patients to other hospitals. Over 9,000 doctors have refused to work, and approximately 10,000 have submitted resignations across the country. This absence of interns and residents in emergency wards has created a significant impact, forcing hospitals to operate under contingency settings. Last week, the country elevated its healthcare system to the highest crisis level. The protests have escalated into a tense political standoff, with the government now considering legal action. Threats have been made to execute statutory powers to strip doctors of their practicing licenses if they do not return by the end of the month. President Yoon Suk-yeol remains firm in his policy to increase the number of graduates by 60%, addressing the country's shortage of physicians amid a rapidly aging population. South Korea currently has one of the lowest doctor-per-patient ratios among OECD countries. Despite efforts to open up medical school placements, opposition from doctor groups has persisted. Public health experts argue that doctors are acting in their own commercial interests. With South Korea's healthcare system highly privatized, the medical profession is wary of increased competition and potential income losses. Professor Jong Hyung-sun from Yonsei University emphasizes that while doctors have their interests, the South Korean people should not endure inconveniences. It remains to be seen how this complex situation will unfold, and we'll continue to keep you updated on the latest developments.